Okay, so welcome to the TRT and Hormone Optimization YouTube channel. And as a guest today, back with us is Gil T. Welcome, Gil.
Hey, thank you so much for having me.
So today, porn addiction, how to get rid of it. So let's first start maybe with the definition. When are you addicted to porn?
Addiction in general is a term that's often defined by various different subjective ways. I consider addiction to be different things. And rather than getting into legal definitions of addiction, I like to get into what I consider to be an addiction to pretty much anything. I find addiction to be a negative term, right? We can have hobbies and we can call things, an obsession, which often is associated sometimes with a positive thing or a commitment or a passion, right? If we're passionate about something, we tend to do it often. We always see that as a positive. The word addiction generally refers to something that hinders your life if you don't do it. Something that causes you trauma or pain or a sense of being unwell if you don't do it. So addictions are generally associated with negativity. They may not necessarily be different than a passion or an obsession because it's still things that you do on a consistent basis. The difference, I think, is what is derived of it. And some people become addicted to things because they feel that they bring them pleasure initially, and then they kind of get addicted in a sense where they can't do without. And I think that anything that becomes obsessive to the point where it drives every aspect of your life and you cannot go a single day without doing it, that essentially can become an addiction. And addictions, society tends to look at as things that are detrimental, things that cause you harm or cause those around you harm. So porn addiction is no different. If it's something that you do excessively, you're aware that it's excessive, you're aware that it is something that you can't do without, then perhaps you have an addiction.
Mm-hmm. And are there any physical side effects, maybe hormonal, of watching too much porn?
As with most addictions, there's always going to be a side effect. Now, some side effects may be adverse, right? The side effect isn't always a negative thing. Side effects is something that I see as just an unintended consequence of an action. So we always have an intended effect, which is the goal of why we do something, and we have an unintended effect, aka side effect. Now, generally, we see side effects as adverse, but they're not always adverse. So a side effect may just be an effect that is unintended, resulting from the action or activity that you're performing. So there's always going to be side effects to everything. Those that you deem to be adverse or negative are, again, subjective. It's up to the individual to determine what they like and what they don't like. Some of the things that we see, and as you know, in my clinic, we see many men who suffer from sexual dysfunction. Yes, it does intertwine with hormones, essentially for many, but for some guys, it stems from other root causes. And one of the things we always diagnose with our guys is sexual dysfunction is what is the underlying root cause. And definitely porn happens to come up quite often, especially maybe in their younger years, some of them still to today, middle-aged or older gentlemen. And one of the things that we find that porn tends to do is it alters your expectations of reality, because you have to always differentiate, just like in the movies, between entertainment and the real world. So men, for starters, tend to get some sense of sexual anxiety because they're always measuring themselves up against these guys that they see in the films. And you got to remember, just like, an average man's not going to walk down the street, look in the mirror and say, well, I don't look like Brad Pitt, therefore I must not be good enough, or George Clooney, or whoever, your actor of choice may be. These guys are in an industry, they're in a profession for a reason. They are the best of the best at what they do in acting, right? And then the porn industry generally doesn't usually just grab some random people off the street. These are guys that kind of work their way up, and women as well. And they tend, but more so with men, right? Because with porn, unfortunately, when it comes to women, they just kind of take whoever's willing, for the most part. But with men, they kind of have to like be a little choosy, and guys will compare themselves to these guys, both in terms of performance and aesthetics and, other attributes and whatnot. And they tend to develop this level of anxiety and have this sense of insufficiency, if you will, for themselves. And that causes lots of anxiety. And that may lead into physical issues that are not necessarily physiological in nature or in root cause, but they're psychological. And sometimes that could be more damaging because it's not things that we can often fix just by giving somebody a medication right there and then. These are things that have to be reworked and retrained, mentally for long. They're irreversible, unfortunately. So that's one aspect. The other aspect is guys tend to develop a state of arousal based on acts and specific, types of women that they may see in these films. And then when it comes to reality, again, some things that may appear pleasurable on screen are not necessarily pleasurable in real life, specifically for the individual who they choose to engage with, and that's often a sense of a lack of reality, and they tend to expect these things, and they may get angry, they may get frustrated when reality doesn't meet their expectation, but they suffer from a lack of arousal or a lack of desire or enthusiasm towards specific sexual acts because it's not what they expect and it's not what they're experiencing in these films. So it's almost a sense of retraining your brain when you're watching these films on a daily basis into thinking that, hey, I need to look like this, I need to perform like this, my partner needs to look and perform this way, and like this is what arouses me because I've trained myself this way for so many years, and now reality always tends to lead to disappointment, so they just become disinterested and disengaged, and it does lead to some psychological issues there, and obviously dilemma within the relationship.
Mm-hmm. So what's your general approach or treatment for these guys?
The first assessment, for me at least, always is have a candid conversation, explain what's on the surface. But before you try to change someone's ways or someone's life, you have to leave it up to the patient to go back and assess a little bit what their end goal is. Everybody wants specific outcomes, but not everyone is willing to walk the path that's required to get to that outcome. So first, before you tell someone you cannot do this and you must do that, you have to first explain to them why it's happening and then say, hey, now that you know what's going on, is this something you still want to fix or change or work on? Because you may be surprised and some people may say no. Now that I see what you're saying, I'm okay with it, and I'm just going to continue to live. It's like when someone comes and says, I want to lose weight, and you say, well, you can't eat this, you must eat this way and exercise and this and that. Go ahead and do it. And now they say, oh, okay, and they go and they fail and they get frustrated. You have to stop and say, now that you understand what's involved, do you still wish to take the steps necessary to reach that goal? Because now that you understand the blueprint, your goals may change. Not because you no longer want the outcome, but maybe it is not worth the journey to you specifically, and that's okay, as long as you're honest with yourself. So first thing, I like to give people the opportunity to understand what's going on, and then ask them, now that you know what needs to be done, are you still willing and able, and do you want to proceed? And if the answer is yes, then at that point you have to start building a game plan. And sadly, that's going to be very different for every individual because not every person is in the same boat. There may be underlying, things that are kind of correlated or integrated into their issue. They may have, someone that may say, hey, no problem, I'll just stop tomorrow. And someone may say, I've been doing this for 40 years. So unfortunately, it's not a blueprint that's a one size fits all. But for the most part, you need to start to bring your mind back into what is there in front of you and not what is a fantasy world of, Hollywood. And you have to start working on these things. And the longer you go down the path that brought you here in the first place without making a U-turn, the deeper the rabbit hole that you're going to dig for yourself. So it is a very complex issue. And for guys to think, hey, medication, this, that, and, this is often a topic that is ignored, and it shouldn't be, because if you don't fix if you kind of sweep the crumbs under the rug, you can have your guests come over and say, wow, the floor is very clean, but there's still crumbs under the rug, and they're always going to be there until you actually get rid of them.
And are there any supplements or medication that could help overcome porn addiction?
There's no supplements or medication that are going to overcome a psychological addiction, short of dealing with a mental health therapist. Personally, I'm not a fan, and I do believe in medicine wholeheartedly. And obviously, there's always a time and place for pharmaceutical intervention. The last resort for me, and this is unfortunately in America always the first resort, but the last resort for me is going to be psychiatric medications, okay, SSRIs, antidepressants, anti-anxieties. Those things cause a havoc on your endocrine system, on your psyche, on your circadian rhythms, on your moods, and even on your physiological processes. So I am not a fan of those unless it's a last resort. And yes, there are people that do need them. But generally speaking, through mental health issues is probably going to be a first intervention. I know general practitioners will often either prescribe or refer out to a psychiatrist who put guys on antidepressants very quickly. And to me, that's a rabbit hole that's very difficult to get out of. So I do not ever, at least in our practice, we do not treat sexual dysfunction with antipsychotics. We just do not. I know there are others that do. I mean, heck, I've heard of guys treating premature ejaculation with SSRIs. I mean, this blows my mind.
Yeah.
So.
Okay. Well, good advice. Thank you, Gil.
It's my pleasure. Thank you.